had a particular affection for endocrine surgery, not only because it really requires a lot of intellectual rigor. It's an opportunity to deal with cancer and to really cure cancer. When I was looking for a fellowship, I wanted the opportunity to learn from experts. I think the biggest thing about Mount Sinai's endocrine surgery program is that it offers a chance to do incredible operations with some of the best surgeons in the business.
Founded in 2010, the Mount Sinai Endocrine Surgery Fellowship Program's mission is to give fellows the clinical training and expertise to become outstanding endocrine surgeons and leaders in the field.
Imagine a fellowship where you are in one of the top hospitals in the US and with people who make it a joy to come to work every day. It's hard to beat that.
When we look for a fellow, we look for someone who is practically going to be our partner. We're a small group and we want someone who's flexible, who's courageous, and who is also interested in forwarding the field of endocrine surgery.
Our one-year program provides fellows with a very unique opportunity to serve the diverse local communities of Manhattan, surrounding areas, and international population.
We have sites at Mount Sinai Morningside or Mount Sinai West, Mount Sinai Upper East Side where the biggest hospital is, and we also have sites at Mount Sinai Downtown and Mount Sinai Queens. We group it in months where the fellow can rotate in blocks of 3 months.
Being able to see those different patient populations and practice in those different environments, I think gives you a breadth of experience that's going to be useful preparing you for the variety of job settings that are going to be encountered by a graduating fellow.
Fellows are exposed to the typical thyroid, parathyroid, and adrenal cases, but also have the opportunity to be trained in cases such as parotidectomy, mandibulectomy, laryngectomy, and tracheal resection, which broadens and enhances the education one would normally receive in many other endocrine surgery fellowships.
From day one, I was in the operating room. There's one endocrine surgery fellow, and what that means is that you sort of get all the attention from the attending surgeons here. There is a big component of a mentorship, not only in taking care of an individual patient, but in learning how to think about these complicated diseases.
We tailor the fellowship to the fellow's need. We allow the fellow to follow 2 surgeons at a time, and if any major case is going on in any of the 5 sites that we operate at, the fellow has that power to go cover that case, because some of the cases that we do are a case for 1 in a million.
I literally make my own schedule. The attending surgeons here, they've been real great resources for that and helping to figure out how to best maximize this time. I think the biggest thing Mount Sinai has that's unique is they've really been pioneers of remote access thyroid surgery, which is an enormously technically challenging operation. So the opportunity to be learning that technique is a huge asset.
We want the fellow to independently participate in research and really be a trendsetter in surgical outcomes.
Investigating the most important thing in thyroid surgery that everyone's worried about is the recurrent laryngeal nerve in the voice box. We're looking at intraoperative video laryngoscopy here, which in addition to monitoring the nerve in the conventional way, we're able to actually monitor the function of the nerve. It's been pretty exciting to be part of.
What also distinguishes our program from others in the balance between a supporting learning environment and graduate autonomy.
I've gotten tremendously better that I can function independently, even probably halfway through this fellowship. The biggest thing I've gained is confidence in the most harrowing operations that we do in endocrine surgery.
One of the best part of mentoring fellows have been watching their careers, and I've been able to witness them go and do great things in different parts of the U.S.
I'm from Louisiana, and I'm going back to Louisiana to do surgery and private practice there. And so I'm very excited about that. What I think is especially gratifying to me is being able to bring the skills that people in the greatest city in the world have access to there. And that's a real great way that the training program here is creating ripples across many different environments.
We are proud to be training the next generation of endocrine surgeons.